Good.
Okay, so get your critical skills checklist out and help me. What we're going to do first is gather all supplies. So I have a mask near Mr. Smith right now. It's not on him yet because I'm still in the gathering point. And so I'm going to perform my hand hygiene. And gathering my supplies, I need what?
Order.
Oh, who said it? Did no one say it?
Okay.
We need a dressing change kit. Yes, we need the dressing change kit. We need alcohol for when we scrub our head. We need 2 flushes. I need 2 because of the 2 that are here. This is the bio patch. And so in your book, we talk about this. We're going to be using a bio patch, but it's not bio patch on your critical skills checklist. So be aware of when we need to do this because we gotta use our brains. We gotta think of when to put this on our field. That's an extra tray. I don't need that. It's an extra mask in case. I think I'm golden. So explain the procedure to the patient and the family. Instruct the patient not to move not to move during the procedure, and I've got him all positioned appropriately. We could have them turn their head if, you know, in a princess perfect world, they may not want this on their face, and they may be going while you put this mask on. So what the alternative could be is have them turn their head. When we're testing, we're gonna put it on Mr. Mannequin Man, just so you know. Okay, so we're gonna put the mask on him or her. Let's see, verify and verbalize the client's identification by saying, please state your name, date of birth, are the 2 patient identifiers. Now I'm going to walk across the room and get my clean gloves. Vigorously, apply clean gloves. Vigorously cleanse the end of each port, right? So all I need is this and this. So how long am I going to vigorously cleanse?
30 seconds.
Sounds reasonable. So, cleaning, 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 cleaning. Time warp, 30 seconds have gone by, but you're going to keep doing 30 seconds, or you're going to verbalize to me, I'm cleaning it for 30 seconds, because we want to see that you're thinking. And then you're going to flush it. Mr. Mannequin won't, but you're going to flush it with the 10 mLs, right? But, oh, what do I have to do first? Unclamp it. Flush it. Clamp it back up. And some very wise, smart person told me, leave it on there. Because then sometimes you have 3 lumens. And you're like, and the patient's moving or it's moving around and you don't know what you cleaned and what you didn't. So, all right, so we got that. We're not leaving it on there forever. We're just leaving it on there for now, okay? All right. So now we're gonna go do it again. And now we're gonna take our second one, clean, 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 scrub the hub, 30 seconds go by, and we're gonna hold it while we open up our second flush, and we're gonna do the same thing, right? We're gonna open up our clamp, flush, it flushes very easily, life is good, clamp it back up. And just hang out for a little bit, okay? We clean up our area, and let's see. We're done with that step. So now I can disconnect it because I'm done cleaning these 2, and I know I did them, and life is good.
Do you ask for blood return?
Okay.
I think you did.
I probably didn't verbalize it when I was, you know what I mean? I probably didn't verbalize it, and I apologize. So let's do it again. We've clean, 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 clean. We're putting it on. We're aspirating. Yes, I see, you know, that blood's coming back in, and then we're flushing with the 10 mLs. Very good. And then we'll do the same thing with this one. Clean, 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 clean. And, oops, come on now. Put it together. Aspirate. Yep, blood's coming in, and flush that blood in there. We cool with that? All right. And now we're done with these guys. Now, this is the fun part. Mr. Smith, I'm going to ask you to put your mask on, and I'm going to stick my mask on in just a hot minute. And because where's my mask? My mask is in the kit. So here comes the fun part that you guys know mostly from NP2. All right, so here's what we're gonna do. We're gonna open up the kit, and these are exactly the same kits you have, if I remember right. They have a box on them, basically. Because that one doesn't. I just want to show you. Sometimes you have to do with whatever the facility has. So, my mask is down in there. I can still grab it without contaminating anything. But the thing I want to do first is I want this cute little bio patch to go in there. Because that's sterile, this is not. Make sense? Oh, and again, let's talk about arranging our tables. Here's my table, here's my client, I'm right-handed. If you're left-handed, you might want to do it this way and do it that way. What we want you to do is think about sterile technique and not, if I'm right-handed doing it this way and I got my table this way, I'm back and forth. So think about how you would like to set it up. We don't care how you do it as long as it makes sense and that you're not cross-contaminating and all of those principles that we talked about in NP2. Now, you'll find that these are, oh, this one went well. The first one I opened at home was horribly, it didn't go the right way, and I was like, but you just figure it out. And I just kind of went like this and tapped it from this side and it fell. So it worked out. So what I'm gonna do is drop my bio patch sterilely into here. See, this one's gonna stick too. And I'm gonna go, ha. Okay. Let's see, now it's time for the mask, correct? Okay.
Yes.
Got it. So I'm gonna just reach on in my little corner. We got this. We'll put on our mask. If you wear glasses like me, I guess it does go this way. We'll do it this way. You can pinch the nose so that your glasses don't get all foggy. Okay, time for your mask, Mr. Smith. We can look cute together. He says, okay. Hand hygiene if I didn't after I took my gloves off. And now get ready to put my sterile gloves on. So I've got one in the kit. So you can do the way we taught you by punching it up and seeing if it'll curl up on you. All right, that one did. That worked out all right.
Do you do this
And, pardon?
Or do you do this before you take off
The old dressing.
Yeah, you guys are right. All right. Awesome. So I realized, oh, yeah, that would suck if I put my new gloves on and I don't have the old dressing off. So yeah, thank you. We're going to keep this here. Will you grab me a new pair because I threw mine down? Just gloves, medium, whatever. And then we're going to begin by moving this. Now, while she's grabbing me gloves, I can talk about this for a second. Again, we're not taking the stabilization device off because you'll find out this afternoon it's very difficult and it would take us forever. Thanks a million. And so we're going to, which direction are we going to take the stabilization or the give me a minute with my words, the tegaderm, which direction are we going to go? From the out to in,
Yes.
and then which direction in regard to our PICC line or our central line? Central.
Like when you're pulling it off
Yeah, which way am I? Yeah.
towards the way that it's going, so you don't pull it out.
Yeah, there we go. That makes sense. So I'm going to go this way because I don't know if you can appreciate this, but it's facing that way. And so I'm going to start. I'm going to start on this side, and I'm going to get to the middle. And you'll see, you note that same thing as what we've done before. Time, date, and initials is on this. And oh, yeah, look at that. It's Monday. And we're going to change it. How about that?
Or it's Tuesday.
Or it's Tuesday. And yeah, and we discovered it wasn't. Good catch. All right.
No, from out to in.
Okay.
They're out.
The outside. Yeah.
Okay, so we're going outer to inner.
Whenever you pull
And
it
we're just going to take that little piece off of in here.
towards the way like that, so you don't pull it up.
And you'll notice, can you guys see this really? Because it's kind of angled this way and I realize that. So you can see what I'm doing?
Yes. Yeah.
Okay. You'll notice this is a bio patch. Bio patch goes blue side up and the actual slit will go with the alignment of your catheter. So while I take this off, this biopatch should just come off, and that's okay. We want that because we're going to scrub, scrub, scrub. And so, again, this isn't always, you'll see it in the book, we don't always change these wherever we are either because they're difficult to come off. So if it is not soiled and there's nothing wrong with it, this stabilization device, this stat lock will stay. So we're going to.
So we're not taking it off on testing day?
Yes, you are.
We are.
Yes, you are. Because remember, I put a new one in there because you'll do that part. Okay, like back up. You're not asking about the biopatch. On testing days, you are not taking the stat lock off and on. It'll be on every patient. So we're just doing this part because this is a clean stat lock. Does that make it more? Was that make it clear? So I was thinking biopatch. So we're very carefully. And then what am I also doing while I'm taking this off?
You're observing like
Yeah, what am I looking for?
the redness, irritation?
Sure. All of those sound good. Sorry, guy. I know we don't usually have corners in our arms, but this guy does. There. Ignore that part. Now, what I did is I put this beautiful stabilization foam, which works wonderfully with a real person, but not so good with this guy. But that's okay. We're going to adapt and overcome. And he might need a little goo gone when we're done, but that's all right. All right, so just pretend that's not there. We're adapting and overcoming, right? Okay, so where am I at now? We are removed that old dressing, verbalizing assessment. What else? Or verbalizing to us what you see. What else? You guys missed one key thing in the checklist.
Intactness of this.
Unless someone said it and I didn't hear you. Intactness, okay. It's intact. There is no redness. There is no draining. There is no edema.
Catheter length.
Yes, the catheter length is right at zero. Zero, I think you just say zero marking, okay? Because there's a zero on this. And it was exactly like this yesterday or a week ago when I changed it. So you're assessing for all of those things. Verbalize, talked about that, okay. Now I've got you see how in the checklist it says now to open up the kit, but I had to open up the kit, we got this, to do that. So now I think I'm ready to start cleaning, my friend. So, how you doing there, Mr. Smith? He says, I'm doing fine. Hand hygiene.
So you have to open up the kit to put on your mask to take that off.
Yes,
Okay.
yes, because your mask is in there. So, and again, all these kits, just like Foley kits, all kits are different. So the one I did when I practiced with at home, the mask was right on top. Life was good. This one, the mask was in there a little bit. So use your head and just, you're picking it up. You're not doing anything else except picking up what you need. Okay? And just make sure nothing else spills out, you know. But this is the practice thing, right? All right, so let's throw these gloves on. And I am going to move my kit further out so that my sterile dressing is going to be right here. And you know, you notice how I'm talking myself through it? You can talk yourself through it. I've had students talk themselves through things. I've had students be quiet the whole time and just do the thing. Any way that gets you through the actual skill is the way that's going to work for you, okay? Sometimes we as instructors answer you, sometimes we don't. So don't be freaked out if we're sitting there just observing you. Or don't be freaked out if I answer you and go, yep, you're good, you know, if you're saying Mr. Smith and I'm Mr. Smith, okay? So, I want to put that down a little. Okay, so, I'm done with that. I don't care about that. Oh, awesome. This actual dressing kit doesn't have a tray, a sterile drape in it, because I don't see one at all.
That's not good.
All right, then I'll work out of my sterile kit, right? You guys are gonna have drapes, I promise you. So we'll modify and say, this is my drape that I just put. What do you want? Do you want me to work out of my kit, or do you want me to work out of the drape?
All right.
Drape.
Drape, I think I'll do drape, only because then you'll be able to see what I have as well, okay? So we put our drape down, What side goes down on the drape?
Shiny one?
Huh?
Shiny side down?
Shiny side down, you got it. Shiny side down.
It's too bright.
Now, critical decision that we have to make. In NP2, we picked it up and went like this. I can't pick that up. That's not sterile. What am I gonna do?
Reach inside.
Yeah, why not? Sterile to sterile. I'm gonna reach inside and I'm gonna look at what I have. Cute little bio patch. This one is a swab. This is the skin protectant. This is, I don't know what we're doing with that. And look at that. So, I have a Tegaderm. I have the skin protectant. I have an alcohol swab stick. I can clean my ears if I want. I have, your kit has a beautiful, actually, a real nice 2x2 in it. And the reason I know that is A, because I've been in the kit, and also I utilized it myself in a minute, and I'll tell you why. So I'm looking at my kit, I'm seeing what I have. I think I'm ready to start scrub-a-dub. What do you think? Okay, and so what type of technique am I going to use? Yeah, horizontal, vertical for at least, right? So in the real world, I would crack this and make it be open, and all the solution would be there, but we're not going to do it and ruin our mannequins. But here's where I was taking your little 2x2 that's in your kit, because if I start scrubbing, well, I've got him taped down. He's probably not going to go anywhere now. But in the real world, to give yourself a little leverage, you may want to take your 2x2 and just do that. You're still sterile, because I'm sterile to sterile. Oops, sorry, guy. I'm sterile to sterile. So you might want to just take that and give yourself that leverage. That's what I prefer to do. So I am basically scrub, 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 for at least, what did you guys tell me?
30 seconds.
At least 30 seconds. And then how long am I letting it dry?
30 seconds.
And I'd like you to verbalize that. Okay? So that's an important step, that we know that you know how long we're doing this for and how long that you need to let it actually dry. And we're going to do the whole entire area that the Tegaderm is going to cover. Does that make sense? So scrub, scrub. No need to be stingy. It goes all over the place. Okay? Now, what I could do as well, especially so I can get under there, I could I could have opened up my stat lock and let it be so I can pull it on up and clean underneath it, but you've got to be very, very, very careful that you don't pull it out. Does that make sense? So you just have to watch what you're doing. So scrub, scrub, scrub. So I did my 30-second scrub. I'm going to use this as a trash can. I let it dry for 30 seconds. What am I going to do now? We already talked about if I needed to change this stabilization device, I would. Okay, the book talks about, what do I have here that I still need?
The blue thing. The circle.
Oh, no, that too. I need my bio patch on there, but I need something first.
The Tegaderm?
It's before the Tegaderm. It's this beautiful little skin protectant. Yes, so that is not on our skills checklist, but you need to do it, because that's going to be on every single time you do it when we go to Fort Walton, if we get to do it. Guess we don't do too many, but you know, if you do it, I want you to, we're going to grab the protocols anyway. Well, this is in the protocol wherever you go. Believes that Sacred Heart too. Skin protectant. Yeah. So it's very common. Okay, so opening up my skin protectant. Okay, we're not going to put this on the mannequin because it'll again ruin him. And then we're going to put it everywhere that Tegaderm is going to be. All over. All over the place. And what does the book say about the skin protectant? Is there a time, or does it just say just apply it? I believe it says just apply it. Everywhere, I think it says everywhere the Tegaderm is going to touch, but it doesn't talk about,
Entire area.
there's something about drying time maybe.
Allow drying completely so skin is not taken.
That's it. That's it. So we're going to allow it time to dry so that we're not going to be in a hurry here. You can see I'm not in a hurry doing this. I'm being very thorough, and we're doing it so that it's done right. Sir?
Does it actually do anything? Does it work? Does it help?
I think the reason they do it is I feel that it's gotta do something, it can't hurt. It can't hurt is what I think. I don't know if anybody knows more than I do. I don't know the evidence on it, but I think it's for an old person that is really paper thin skin. Anything you put on has a chance of helping versus ripping half their skin off. I don't know if you guys feel any differently.
I think they do that half the time.
And you'll see that some people, if it's not in their protocols to do it, they may not use it. There was something else Miss Lopez told me that she said she does, but she's seen people not do, but I'll have to think of it. So you'll see adaptations of this skill everywhere you go. You'll do your own adaptations. You may think I'm crazy for taking that swab on there and stabilizing it. You may not need to do that. Okay, so we applied the skin protectant. We're gonna put the BioPatch on, and how are we gonna put it on?
Blue side up.
Blue side up, so this is kind of green. So blue side up, and where's the slit gonna be? Basically it's gonna be right below our PICC line, our central line, 6 o'clock if you're a 6 o'clock. If you're an orientation of a clock person, it's gonna be that way, okay? And so it's gonna be right around, what does the BioPatch do? Anyone? What's it got in it?
Probably antibiotic.
It's got some medicine in it. That's right around the insertion site, so that we're once again giving them another layer of protecting them from a central line associated bloodstream infection. So that's why the BioPatch is. Now, the book doesn't say words BioPatch word for word. They'll say an antiseptic impregnated disc, or I can't remember. Huh?
Chlorhexidine impregnated dressing.
Oh, it was kind of close. Yeah, so that's pretty much, and then actually that, I believe in particular, some of these things have chlorhexidine in them too as well, or they have dressings in them. So what I'm saying is it doesn't say BioPatch, but we're gonna do the BioPatch, and both facilities use the BioPatch as well. So how am I doing? Looks like I'm ready for my transparent dressing. Anyone? Bueller? Okay. So this is, you're very familiar with these. These look like, it looks like an IV on steroids, an IV protectant on steroids, an IV upside, I always call them upside, an IV Tegaderm on steroids because it's a bit larger. So it's the same process too of opening it up.
Excuse me, it's saying that you have to label it first before you put it in the patient.
Right, and I have the label on this
Okay.
side. And then what I'll do after I'm done being sterile is I'll take it and then label it. It's the only way you can do it.
Okay.
Also, well, this kit doesn't have one, but your kit has a couple different labels. So dealer's choice. You can use the kit label, you can use the one right here. As long as it's labeled, we don't care. So I'm going to, how are you doing, Mr. Smith? He says, I'm doing well. Great. And then I'm going to put it over the entire area. Now, am I going to leave a bunch of air underneath this? No. Just like with IVs, we're going to push, 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 push. Push, push, push. Because what does air do? It grows bugs. It grows bugs on us, doesn't it? It does. Air. You need air to grow germs. Okay, now, this is a little more difficult because he's got a corner on his arm. But now, here's where Anastasia was asking about my time, date, and initial. It's just like with the IV. I can take this whole thing off.
And this is where you can break sterility, right?
It is covered, right?
Yes.
Absolutely. This is where we're done with the sterile portion of it, and now we're just polishing up our act and making it look good. So, and this is probably at the point where Mr. Smith's gonna go, can I take my mask off now? And I can go, yeah, I'll be taking mine off in one hot minute. So, okay, I'll tuck it under your arm there. So we have this. Now, like I said, my great idea, and you have it in your kit, was to elevate my tubes a little bit with a little piece of tape that came in your kits. You don't have to be fancy. In fact, I'd probably prefer you don't because it really does leave a mark. I don't know how you guys feel, but it leaves a mark on the, and it'll be harder for the next person. I guess is what I'm saying. So let's just not be too fancy. We'll just do it this way. I can now take this off. Mr. Smith's going, oh my gosh, this is terrible. And time, date, initial. Let's steal one of your. Thank you. Oh, it's pretty, isn't it? Is it gonna write pretty or is it gonna write blue or black?
It's gonna write blue.
Okay. Oh, it's a pretty blue. We should do black. 8, 23, 16, 11, 21. Okay. Did you guys, did I miss any major steps? We're gonna document it where? Besides here. Medical record. All right. And what are we documenting?
The procedure that you did, the time, the day that you did it.
Time.
But what the dressing looked like before.
What it looked like before. Okay, good. What it looked like, what your assessment. Remember, we verbalized what it looked like and that there was no dreading. You better be writing that. Okay, so everything you verbalized at the bedside has to go. Okay. All right. Questions, comments, concerns?